After a long and thorough debate, we are on the verge of passing health insurance reform that will finally offer Americans the security of knowing they'll have quality, affordable health care whether they lose their job, change their jobs, move, or get sick. The worst practices of the insurance industry will be forever banned, and costs will finally come down for families, businesses, and our government. Now, it'll take a few years to fully implement these reforms in a responsible way. But what every American should know is that once I sign health insurance reform into law, there are dozens of protections and benefits that will take effect this year. Uninsured Americans with pre-existing illness or condition will finally be able to purchase coverage they can afford. Children with pre-existing conditions will no longer be refused coverage, and young adults will be able to stay on their parents' policy until they're 26 or 27 years old. Small business owners who can't afford to cover their employees will be immediately offered tax credits to purchase coverage. Early retirees who receive coverage from their employers will see their coverage protected and their premiums go down. Seniors who fall into the coverage gap known as the donut hole will receive discounts of up to 50% on their prescriptions as we begin to close that gap altogether. And every patient's choice of doctor will be protected, along with access to emergency care. Here's what else will happen within the first year. Insurance plans will be required to offer free preventive care to their customers so that we can start catching preventable illnesses and diseases on the front end. They'll no longer be allowed to impose restrictive annual limits on the amount of coverage you receive or lifetime limits on the amount of benefits you receive. They'll be prohibited from dropping your coverage when you get sick and need it most. And there will be a new independent appeals process for anyone who feels they were unfairly denied a claim by their insurance company. In short, once I sign health insurance reform into law, doctors and patients will have more control over their health care decisions, and insurance company bureaucrats will have less.